broken down to B3, 4, 2Bs. So then, as you see, we are using undocking the mechanism and also the docking mechanism to make it the transformable. And also we realize that the more number of the particle, the faster the velocity of the microswimmer. So in order to create the more powerful the deep penetration in the tissue construct, we just fully utilize this kind of the mechanics inspired by virus. It's a kind of the one the bacteria. So then we do also the many different the medical the tasks in bodily fluidic environment. And also interestingly, we also fully utilize a nanoscale the particle. So these are the 50 nanometer diameter iron oxide nanoparticle. So then they just mimic exactly what bacteria are doing in the bad fluidic environment. So single nanoscale the particle could be aggregated to be the swimmer. Then eventually they just also form the multicellular the structure. So it looks like a snake. So then we introduce rotational magnetic field. So then they can just swim like that. So micro swimmer and also the nano swimmer. So the nanoscale, we have to also overcome a couple of the obstacles. Number one, caused by the Brownian motion. Number two is unstable the flow, the environment. So there is the more uncertainty for the better controllability. However, using many different types of the control algorithm, we try to overcome this kind of uncertainties. So eventually, we are further functionalize the micro, the nano robots for especially in vivo applications such as localized and targeted drug delivery and minimally invasive surgical procedures. For example, outer surface of this micro robot could be functionalized by the antibody. So eventually, antibody antigen binding could be used for the drug delivery. So basically, based on MRI imaging, we know where our target is, right? So then we just inject this micro robot using syringe close to the target. So then we just take time for them to be the diffusion-based the release. So then eventually they just create the binding. So then we just apply the rotational magnetic field so that these micro robot can penetrate through the tumor membrane. So then the drug could be exploded inside of the tumor. In addition to these types of the biochemical functionalization, we also fully utilize mechanical force by the external the power sources, such as the magnetic field. So as you see over here, we have already done some experiments in artificial blood vessel. So then we try to overcome the reverse flow to deliver our drug the payload onto the target. And we also further functionalize our robot physically by the use of MEMS and the NEMS technology. So interior of this micro robot could have the gripper or the welder and also the cutter. So then they just do the engineering work with high accuracy. Basically, based on that, we can just achieve the many different medical surgery. So this year, I'm very excited to have the animal experiment. So a couple of the mice are said to be the first patients for this brand new the kind of heart disease, the treatment. So then we will move on to the testing in rabbit and also the pigs. And if all goes well, by 2019, we will be launching this micro robot into the human body through catheter the injection. Thank you.
Thank you very much. Please have a seat. And we welcome on stage Professor Steve Moyle from Oxford University to debate with us. Nice to meet you. Hi. Well, congratulations, I mean,
Thank you.
for this. Professor, this is incredible how this technology, like, micro swimmer robots, could be a part of a big answer for big health issues. Do you agree with that?
Yes, it's a fantastic technology. In fact, it's clearly fantastic. We see it's come from science fiction, and now you've made it science fact. It seems limitless, really, what sort of interior in the body procedures you can be able to do with this technology.
We are aiming to introduce this micro robot into the two different areas. Number one is the blood vessel, the other is the brain surgery. So basically, based on the control algorithm, we can actually achieve the very accurate the cutting and the welding the procedure. Yeah.
So almost like a complete engineering team inside the body,
Exactly.
servicing, maintaining, changing the insides of our bodies.
Right.
Yeah, that is very interesting regarding the, the monitoring, if I do understand well, of what the body is testing, probably a new protocol or something like that. That is very interesting.
Yeah, I think so. Because the most of the thing was realized in the sci-fi movie, right? So it takes even the 50 years for my research group to realize this kind of technology at the present time. But there would be a lot of the potential to be used for the many different medical application.
Just a question about how long have you just experienced such a technology?
Okay, so I have it has been about 10 years since I engaged in this kind of the micro nano robotics. But at the beginning, we are fully utilized flagellated bacteria as a sensor and actuator for micro robotics. However, we realized that the bacteria could not be introduced into our bodily fluid environment because of the immunological issue. So then 5 years ago, we started using many different types of the magnetic particle approved by the FDA. So these particles are the biocompatible and the biodegradable, so only a matter of controllability. So then we developed many different control algorithms to utilize these particles for the drug delivery and minimally invasive surgical procedure.
And question for you, Professor, to end. We just see as this overview of Netexplo innovations that health is so, technology are very efficient to the health in a way spectrum. Is it something you're looking after? You're very keen on?
Well, I think health is a rich area for technology. There's a lot of health innovation going on. This is clearly on the leading edge. But it's, in some sense, we have to take some responsibility for our own health. We can't just let the micro robots come in and keep us well. We need to work on that ourselves. So there are other digital technologies that help us monitor and improve our own health.
But robots are, we can expect many things from robots or, nano technologies, etc. That's very
Yeah, I think so. Over here, I just emphasize in vivo application based on this micro nano robotics. However, there are also the tons of the application in vitro. So, for example, we can utilize this kind of the robots for the manipulations and also cell therapy in vitro environment. So probably there are the many different the potentials for to be used for other the technology.
And just the last question, what is the next step for you?
Excuse me?
What is the next step for you?
As I said, we have to do animal experiments, whether or not this technology would be peaceful inside of the human body. So if it would be successful, then definitely next step is to do the human trial.
So yes, that.
So who's going to be the first human to try it? First living human?
Yes, good question. Thank you.
Why not you? If you have a lot of cholesterol.
Sure, I'm happy to give it a go.
Okay.
Thank you, Professor. Thank you.
My pleasure.
Minju,
Thank you.
Kim, thank you both. We can put here the microphone. Thank you. And we will explore another trend with Cedric. Thank you so much.
Wrong exit, doesn't matter.